in medical news this morning, into what could be a revolution in the way doctors treat breast cancer.
Targeted intraoperative radiotherapy.
Moment of hope, a possible change in the approach to treating breast cancer.
Well, the results of groundbreaking breast cancer research could dramatically change the way some women are treated with radiation.
Now there's a new therapy being tested that combines surgery and radiation into one single visit.
We're treating the breast from the inside out.
That not only saves time, but also side effects from the radiation to the breast tissue, to the heart, to the lungs, and is a much better approach.
This machine makes it possible. It's called Intrabeam.
On June 7, 2010, the Target Clinical Trials Group caused a paradigm shift in the way women across the world would be treated for breast cancer. At the American Society of Clinical Oncology's 2010 annual meeting in Chicago, the results of the International Target A multi-center clinical trial were announced. The data, published in The Lancet, established a non-inferiority between 6.5 weeks of arduous external beam radiation and one single dose of radiotherapy with the Intrabeam system, delivered during surgery from inside the breast. More than 2,200 women at 29 centers in 9 countries around the globe participated in the largest randomized clinical breast cancer trial for partial breast irradiation. And in all the centers, for all the patients receiving a single dose of radiation, only one radiotherapy system was used: the Intrabeam radiotherapy system. From Carl Zeiss.
In medical news tonight, a lot of doctors and breast cancer patients are weighing a new study that offers a possible new approach to treating breast cancer in its early stages.
The interest in the clinical study results generated more than 150 national and international news stories about the Target trial and the Intrabeam system. Some of the most powerful broadcast, print, and online media outlets told the world about the outcomes of the Target trial and the tremendous benefits of targeted intraoperative single-dose radiotherapy.
The Target trial is one of the most important studies that has been published regarding breast conservation since 1986.
Breast cancer surgeon Dennis Holmes talking about research recently reported at a meeting of the American Society of Clinical Oncologists.
Results of the international trial have been published in the journal Lancet. With about 2,000 women participating, the group that received traditional external radiation had a recurrence rate of slightly under 1%. The internal radiation group was just more than 1%.
This device, called the Intrabeam, delivers a dose of radiation right into the tumor bed.
There was an equivalent local control rate. In other words, the amount of patients who recurred was the same relatively in each group. So it was a positive trial for using just this intraoperative radiation for the select group of patients with lower risk cancers.
So this is done one time while the patient's asleep, which is very new and exciting. So those type of women who have the lower risk of potential local recurrence, and instead of having a 3 to 5 week course of radiation daily from Monday through Friday, now a one-time dose appears to be adequate.
That not only saves time, but also side effects from the radiation to the breast tissue, to the heart, to the lungs, and is a much better approach.
We have found that the radiation-induced side effects like scarring and the texture of the breast is significantly less. It is a safe technique, and safety is paramount in any new technique.
Surgeons here at the Royal Free Hospital are already convinced that radiotherapy during surgery will eventually become the standard treatment for the majority of breast cancer patients. Fergus Walsh, BBC News.
One landmark clinical trial. One intraoperative radiotherapy system. The Intrabeam radiotherapy system. From Carl Zeiss Meditech.